Well, hello, hello, and good morning. Good morning. Happy New Year. It's 2023. Can you believe it? And I know you are ready, 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 and excited to take baby into a new year. You are equipped, you are getting better at what you're doing, and baby is thriving. Wonderful, wonderful. And I am so happy to be able to share in your excitement and in baby's growth and to help you raise the next generation of successful children. This is Dr. Yonnette. I am coming to you today with a discussion that we started yesterday. Yesterday we started talking, Friday actually, we started talking about obesity and the prevalence of obesity and how many people in America are dealing with this condition. And today I want to talk with you a little more about what causes obesity and how we can control it. Of course, what I present is based on the CDC information. And so let's talk a little bit about what may cause your baby, your 2 year old, your 5 year old, your adolescent, and even adults to become obese. And what actually is obesity? Obesity really is a complex disease and it occurs when your baby's weight, your child's weight is higher than what is considered healthy for his height. So it's weight against height. And obesity affects children and adults. And there are many factors that contribute to excess weight gain. And if you think about it, I know the first thing you're going to say is eating, your eating patterns. Yes, eating patterns, physical activity level, and your sleep routines. In addition, there are some social determinants that affect your health or your obesity, and they include genetics and taking certain medications. And these may play a role into how your weight plays out. So let's look at food, activity, and sleep. Eating and physical activity patterns, if you have insufficient sleep and several other factors, will influence your gaining of weight. And not just gaining weight to the point where you become obese. Obesity is like beyond just being heavy. It's really, really heavy, if I can explain it in layman's terms, so that you are not able to participate in many of the activities that other children your age are able to do. So, what are some of the social determinants of health? The condition in which we live, where we learn, where we work, where we play, those are what we are referring to when we talk about social determinants of health. So it can be difficult to make healthy food choices and get enough physical activity if the conditions do not support health. We hear a lot about food deserts, where certain communities where you cannot get healthy fresh foods. So we there's a determinant there for health, a healthy weight, a healthy weight in your child. Now, these determinants also affect the chronic diseases outcomes and the risk factors, and they also affect obesity. And among racial and ethnic and socioeconomic groups as well, there is a difference in the physical abilities of individuals. Now, places such as childcare centers and schools and communities affect eating patterns and activities through the foods and the drinks that they offer and the physical activity opportunities they provide. I was talking with an individual yesterday, and we were just talking about libraries, that libraries are still in existence. And now the libraries have changed. They are including gyms, and they are including basketball courts and opportunities where you can get up and move so that you can decrease decrease your chances of becoming obese. So now let's look at genetics, because genetics can also play a part in obesity. Genetics changes in human population occur very slowly, and these changes can also be responsible for the obesity epidemic that we are seeing among us. Yet there are variants in several genes that can contribute to obesity. But it's rarely that there's a specific variant of a single gene that can cause a single obesity gene that cause a clear pattern of inherited obesity within a family. That's a mouthful. But let me say this in layman's terms. There's no real gene that will cause you to be obese, right? There's no single variant gene that causes you to be obese. You can work on this condition and keep yourself at a correct weight and keep yourself healthy. Now, illnesses and medication. Some illnesses can cause, such as Cushing disease, and can lead to obesity and weight gain. And drugs such as steroids and some antidepressants may also cause weight gain. And there is research that continues to look at the role of other factors such as chemical exposure and the role of microbiome in obesity. But you are not helpless, moms and dads. As you raise the next generation of successful children, you are not helpless. You need to equip yourself. You need to arm yourself so that you can help your child. Let's look at eating patterns. Healthy eating allows for the child to grow and develop a healthy weight. There are a variety of vegetables, fruits, whole grains, lean protein foods, and the low-fat and fat-free dairy products that can be used to help your child develop a healthy diet that will keep him or her from becoming obese. Then, you also want to limit foods such as beverages and added sugars. I see a lot of children drinking down on the sodas and the Cokes and Pepsi and Sprite. You want to limit those beverages. You want to limit the candies. You want to limit solid fat or sodium. And you want to make sure that you manage the nutritional quality of the food that you are giving to your child. There is the Dietary Guideline for Americans, 2020-25 Dietary Guidelines that you can use. There is the Healthy Eating for Healthy Weight Guidelines that you can use. And there is the Food Service Guidelines Implementation Toolbox. Can you believe that you have a toolkit to implement the correct food that your child will thrive on? Let's look a little bit at physical activity. Physical activity, it is recommended that children ages 3 through 5 years old should be physically active throughout the day. Children ages 6 to 17 years old need at least 60 minutes of moderate to vigorous physical activity every day, and adults need 150 minutes of moderate to intense physical activity a week. I'm going back to the libraries where the communities are creating environments that make it easier for people to move. There are lots of parks around where we live. We can go out and walk. There are lots of trails. There is the bicycle lane is also now available to help you to be engaged in physical activity and get moving. And here again, There's a physical activity guidelines for America that you can use to help you know exactly what your physical activity needs should be. Also, there's a physical activity for different groups, and then there's community strategies. So you have lots of resources that you can use to prevent obesity. Now let's look at sleep. In newborns, going back to you moms with your babies, newborns need 14 to 17 hours of sleep per day. And that amount will decrease as the child grows. Teenagers need 8 to 10 hours of sleep per day. And adults need 7 or more hours of sleep per day. So remember, your sleeping patterns can also impact your weight. So make sure you're getting the correct number of hours when it comes to sleeping. And then the social determinants of health. State early care and education system can promote standards that address nutrition, infant feeding, physical activity, and screen time. So again, here is your guideline. Look at your early care and education, and you'll see information there that is relevant to your state. Now, there are community programs, there are initiatives, public health practitioners can also work together to remove barriers to healthy living and healthy weight. I know that you are very excited about having a child and having the opportunity to raise your child. Make sure that as you do that, you are giving the child the best opportunity to succeed. Manage the diet. Teach your child the correct eating patterns from now so that he or she can develop those patterns into adulthood and help your child have the quality of life that would help him to be successful as you raise the next generation in this century. This is Dr. Yonnette thanking you for joining me on this first day of the new year. And I want to pledge that together we shall work, we shall become knowledgeable, we shall gather the resources to move our children forward and to make them successful. Have a great new year and have a prosperous day.